if you're depressed and you need to see a psychiatrist, then that might affect your marriage chances. That might affect, your
Your job.
other family members from
Yeah.
getting married. You understand?
Mm.
And we often have this thing, even like, say, with our children. Let's say, God forbid, if someone has a child suffering with ADHD or ASD, I
Yeah.
often hear Nigerians or Africans say things like, I don't want my child in the system. So we don't trust the system because we feel our child will be labeled. So
Dr. Akeem Sule is the co-founder of Hip Hop Psych and a consultant psychiatrist in General Adult Psychiatry, Essex Partnership University NHS Trust, and an honorary visiting research associate at the Department of Psychiatry, University of Cambridge. He is also a senior member of Wolston College, Cambridge University. Dr. Sule has taught and given lectures to psychiatry trainees and resident doctors in the United Kingdom, Hong Kong, Singapore, Egypt, Nigeria, Brazil, Ireland, Turkey, and India. He is a member of the Association of University Teachers in Psychiatry. He obtained a medical degree from the Ogun State University Teaching Hospital, Nigeria. His specialist psychiatry training was with the Oxford Rotational Scheme. He also worked at the Department of Psychiatry, University of Oxford, and Hammersmith Pet Center as a clinical research worker doing neuroimaging research. Dr. Sule is an international fellow with the American Psychiatry Association. Akeem also helped set up a module on the Wire TV show for a medical student psychiatry course in a Texas medical school to teach on social determinants of mental health.
Welcome everyone to this special conversation, Whispers Beneath the Waves, Hidden Struggles and the Bravery to Ask for Help. We all know that many of life's deepest struggles remain unseen beneath the surface, and today we are going to explore the courage it takes to acknowledge them and seek support. Now, it is a rare privilege to be joined by Dr. Akeem Sule. He is a distinguished consultant psychiatrist whose expertise, insight, and dedication have touched countless lives. So we are truly grateful that he has taken the time to share his knowledge and experience with us. I can tell you that I've been on his neck for the past, over a year.
sorry.
But I'm super grateful. I'm super grateful that he has finally decided to honor this invitation. So, Dr. Sule, thank you for this valuable opportunity. And we are here, we are very honored to have you with us, and we look forward to learning from your experience and perspectives. So let's dive right in. Good morning, Dr. Sule. How have you been?
I've been fine, thank you. Thanks for having me. It's an honor to be on your podcast. Thank you very much.
Yeah, thank you so much. It's such a pleasure to have you on this platform, really. So yeah, you are a consultant psychiatrist. So how has the journey been so far?
Well, to be honest, it's been an amazing experience because I did my training back home in Nigeria. I went to the Ogun State University Teaching Hospital. My specialization was here in the UK, first in Stoke-on-Trent, then Oxford. And my first consultant job was in 2007 in Bedfordshire. So I've worked in different places, Bedfordshire, as a consultant. I've worked in Cumbria, and now I work in Essex. So it's been an amazing experience, really. I've really enjoyed it.
Wow, that was a rich background, combining, your home country experience with the UK experience. That must have really been a rich experience for you. Yeah, personally, I see what you do on the ward, and I'm really amazed at, the way your relationship with your patients and how you have, successfully helped people that have been through, psychological and mental struggles, really. And I must commend you for what you do. Okay, so looking at the topic we are looking at today, Whispers Beneath the Waves, uncovering hidden struggles and the bravery to ask for help. When I sent you the invite and you look at the topic, when you hear the phrase whispers beneath the waves, what does it evoke for you as a psychiatrist?
Yeah, I mean, it's interesting. The phrase whispers beneath the waves. It's interesting because when you think about the waves and on the sea or water, you see it as really rough. You see it as something which is big and enormous. And it's interesting it says whispers rather than shouting, because when you think about waves, the thing it evokes is panic. And in order to get the help, you shout. So for me, whispers means whoever that individual is doesn't feel they can ask for help. That's what really struck me. It seems a paradox. If it was shout beneath the waves, I think that would be more appropriate. So yes,
Okay, maybe you're gonna change it to
beneath the
shout beneath the
yes,
waves.
yes, because you
No,
can't remain
but
calm if you have the waves of life coming.
yeah.
Yeah, you shout, so you get the help, isn't it? So yes,
Yeah. But unfortunately, lots of people don't know how to shout for that help. We
that's
just begin to whisper, and the whispers is the silent struggle. We try to struggle emotionally within ourselves before we eventually come to that realization that we need help. Okay,
very
so
true.
moving on, in your experience, what are some of the hidden struggles people carry that those around them often don't see? Remember when you were talking, you were like, if it is
Mm,
shouting, but not everybody. Yes, some people have the rare privilege to actually shout for help when they need
yes.
them the most. But what about those people that actually struggle? So, in your experience, what are some of the hidden struggles people carry that those around them often they don't see it?
Yes, yes. So the thing is, you could divide it into what you call life issues, which eventually lead to mental health problems. So I think the typical answer you would expect from me as a psychiatrist is when people are depressed, when they're anxious. But what we don't often talk about are the things that lead to that. So, for
Mm,
example, job stresses. For
mm,
sometimes coming from our background, where you've got to send money back home, their financial
mm,
challenges.
yeah,
People don't always feel the able to tell their family back home that they can't send that money,
yeah,
or they're finding things difficult. So financial challenges. For some
mm,
for some people, it's marital stresses, really.
mm,
Sometimes, again, I don't want to just make this about people from African backgrounds, but
yeah,
sometimes we can be so spiritual. We've got to have everything
mm,
together. So we're having marital challenges. We don't feel able to speak about that.
mhm,
Sometimes it could be difficulties with our children.
mm,
And by the time we look at all these stresses, then it can lead to depression. Now, when people are depressed or anxious, sometimes from our cultural background, we see that as a weakness. We feel as
mm,
Africans, we should be happy. And I think, particularly among African cultures, this whole idea that, fella said it's suffering and smiling, where
yeah,
we're supposed to be happy. And I don't think I don't think, like, for example, when they say Nigeria is the happiest country,
mm,
I think that whole, what do you call it? Oh, we're smiling in the face of poverty. I
capacity,
don't
yeah,
think, yes, I don't think that helps a lot. And I know
mm,
sometimes we're expected to be very spiritual. So
yeah,
this Nigerian phrase in Pidgin English, you go better.
you go
It's not always
better.
a helpful phrase, because sometimes
Mm,
that's just like using a masking tape to
yeah,
cover what's really, really broken and what really needs to
mm,
be addressed. It's okay not to be okay. It's okay to be sad.
yeah,
So yes, sorry,
yeah,
I know I've rambled on a bit, but
yeah,
you'll
no.
probably be getting those kind of responses from me.
Yeah, honestly, yeah, I think that
Mm,
was a very profound statement as a
mm,
response because it's so obvious, it's very what's they call now? Like it's a pertinent thing to know that we all have, these job stresses, financial challenges,
yeah,
and there are people, from our home country that are really expectant that okay, I need you to do that for us. And there is no amount
absolutely.
of explanation you give to them that
Yes,
they will understand because they are not in that economy. Okay,
absolutely.
now talking about the African background, we all
Yeah,
know that mental services are not absolutely rampant. I know of one
yeah.
in Abeokuta,
Mm.
the psychiatric hospital in Abeokuta, but
Arrow,
then they're not
arrow,
really
psychiatric.
arrow, yeah,
Yeah.
they're not really rampant. But then when it comes to depression, I
Mm,
know people will not really see it as something they need to seek help for because they feel
mm,
that they are just depressed. Okay, let's go out, to go better, like you
mm,
mentioned. Now, what are some misconceptions people have about this mental illness and emotional distress? Because when they say mental
mm.
illness, they really think is really, really that the acute psychosis alone. You know, they don't see anxiety, depression, and all of this as a mental illness. So what, in your experience as a psychiatrist, what are some misconceptions people have about mental illness and emotional distress?
I think some of it, like you said, is this ability to just brush it off. Like you said, sometimes it's a case of like snap out of it. This whole idea that you can just snap out of it. And I also think, given our religious background, that it's a spiritual attack. So if someone is feeling down, this is a spiritual attack. If you mention the word depression, because let's be honest, I think compared to how things were, because when I was in medical school, we did our training in Arrow Neuropsychiatric Hospital.
Okay.
I think that was years ago. I think there's more awareness, and I think we're getting better. I think sometimes, like, you know, whether we like to agree or not, like TV shows, you know, have highlighted mental problems. Not always good. For example, Blood Sisters, the first part, you know, where they spoke about addiction. I felt that was a good TV show. There was one TV show called The Grill, which, when you look at it, the grill there that had this gift actually appears to be suffering from social anxiety disorder. So I think there are TV shows explaining that. So I do think that there is an awareness, but I also think that sometimes there's a concept in Nigeria that once you have it, you're somehow tainted and you can't get better. I think the awareness about the treatment that helps could be a lot better, if that makes sense. Yeah,
absolutely. Because I can remember ages ago, when you look at the African television, they don't really talk about therapy. But just like you mentioned, some TV shows, they're announcing therapy, especially for postpartum depression, whereby they just feel like nobody understands what the woman is feeling after childbirth. So there is more awareness now, and I think the misconception is actually dying down. Thank you so much for that submission. Okay, I'll move to the next one. Although, let's, as a consultant psychiatrist, what are the signs that someone will be struggling emotionally, even when they are functioning well in daily life? Like you go to work, you are happy, but inside of you, you know you are struggling emotionally, and yet you still have to keep up with your daily life.
Yes.
What are the signs?
So if we think about whispers, beneath the waves, that's a really good, like it's a very good example. Sometimes you find the moment the person steps in the house, they're quiet. There might be disturbances in sleep, so they're happy, but they're not sleeping well. You understand? They're not eating well. They're losing weight. Another one which I find quite very, very interesting, especially among our African culture, with mental health problems, if you think about it, if it's not expressed, sometimes that can show up with what we call somatization symptoms. So somatization symptoms are when all of a sudden people are complaining of headaches, burning heat. So like when we were back in Nigeria, one of the manifestations for depressions were things like, somatic pain, headaches, burning heat. Because even if we think about it, like as Yoruba people, there isn't really a Yoruba word for depression, is there? You understand? If we think about it, we will say things like, aramikoda, you understand? Yes, sorry, my Yoruba could be a lot better. Or something we would say is inumikodun. So we say the absence of happiness. But ronu, one really good mon ronu, when you hear that word, I think that is what we would call in English rumination, where you're just thinking, when you, I'm sure we've seen it, where someone is just sitting down and just thinking, ruminating, especially for depression. I think that's a very good one. So somatization, rumination, I think is something that we could say with such people, you understand? And it's interesting, in our culture, we often, that is something we acknowledge, that Monronu,
it's not happy, it's been thinking.
It's been thinking, yes.
Yeah.
And I can recall when I grew up in my area, my mom was a psychiatric nurse. My mom was at Arrow Neuropsychiatric Hospital. I remember there was one of my classmates, he finished from school, he didn't have a job. and he would just go around the town, not the town, but our area, and he would just be thinking and thinking. And my mom was like, this guy is depressed, and eventually ended up taking his life. It was so sad, really. You understand? But the signs were there where you could just see him pondering and thinking, you know?
Probably sometimes talking to himself.
Yeah. No, funny enough, he wasn't.
Wow.
But you could see he was thinking. You know, when someone is deep in thought, you know?
Yeah.
Yes.
Wow. Thank you for that. Again, I want to cite an example because when you were talking, I just remember having a discussion with a friend of mine, and we were talking about a particular couple. You know, this husband, whenever there is any little misunderstanding, he just withdraw. And it can go like that for 2 months, for 3 months, you know, not talking in the house to the wife. Any little thing is snappy, any little thing just go back into his shell. I can consider this type of behavior as a mental health issue.
Yeah. Well, we have to be careful not to label any behavior, but yes, it can be. Yes, it can be. It can be. It doesn't mean all the time it is, but it could be a sign. You understand?
Okay. Okay. Anyway, we'll get there and we'll look at how we're going to get support to that. So yeah, you talked about I don't know if I should ask this. I think you've actually mentioned this. How do expression, I mean, depression, anxiety, and burnout sometimes present differently than people expect. Like the example I gave to you, is that a form of burnout, like, or maybe loss of interest, or you know?
Yeah.
I don't know. You don't deal with the diagnosis, so what can it be really?
But you know, I've thought about it. You see, there's a lot of overlap. So let's take them one by one. So depression and anxiety are more clinical. With depression, the symptoms you get are feeling low in mood, feeling tired, not enjoying things, poor appetite, poor sleep, that. With anxiety, you get different symptoms. You get thinking symptoms. So these are often catastrophic things. Things are going to go wrong. You have a foreboding sense of doom. You think something bad is going to happen. You understand? Then there are physical symptoms. Often, if you think about it, the autonomic nervous system, where you have the release of noradrenaline. So the heart is beating all the time. They're sweating, they're trembling. So that can be there in the background all the time. Or you can have panic attacks where you have a real extreme form of these physical symptoms happening over a period, then relief in between. So that would be anxiety. And along with that, you can also have things like muscular tension, dizziness. So that's anxiety. Burnout is a very interesting term because burnout doesn't allude to any example, but you could have burnout with anxiety or depression. Burnout often relates to a job. And often when people use the term burnout, it often refers to an emotional exhaustion or
parenting duties.
Yes, or stuff. But it's often related to a job or duties or some kind of work, whether that is parenting or a particular stuff, really. So a burnout could manifest as clinical depression or anxiety or low-level anxiety or depression or something in between, if that makes sense.
Yeah. So now with all of those symptoms that you have mentioned, like low in mood, thinking, rumination and all of this, why do you still think that some people wait until they're in crisis before speaking to someone? I believe they must have seen the warning, really.
Yeah, because sometimes it's a case of they don't really know. Do you understand? You know, sometimes you have to be emotional literate to know that these are symptoms that might indicate mental health problems. But when you've not been taught that, you don't see it as being a manifestation of mental health problems. I think one of the thing, and so that is one. So it's the mental health literacy. One of the good things about this country is that people are mental health literate. So when those things happen, they have the language, they have the vocabulary to express themselves. So that's one. And secondly, for those that know, then there's the stigma aspect, which in our culture, you can't say it. How can a man cry? How can a man be? Do you understand? So,
Yeah.
or even a woman, how can you express that? And even
Mm.
if you suspect you've got mental health problems and you're depressed, think about the stigma that happened. If you're depressed and you need to see a psychiatrist, then that might affect your marriage chances. That might affect, your
Your job.
other family members from
Yeah.
getting married. You understand?
Mm.
And we often have this thing, even like, say, with our children. Let's say, God forbid, if someone has a child suffering with ADHD or ASD, I
Yeah.
often hear Nigerians or Africans say things like, I don't want my child in the system. So we don't trust the system because we feel our child will be labeled. So all these things together mean people aren't likely to talk about these things.
Wow. So basically, it's all about the ignorance or the stigma that comes along with being
Yes.
diagnosed with all of this.
Yes.
Mm. Well, or better say, I'm thinking, is this something I know in the United Kingdom and other European countries is accessible, like mental
Yeah.
health, to accessing the mental health sector is
Mm.
accessible. But in African countries like that, being that the awareness is now coming on,
Mm.
people are getting more aware about the importance of, mental health and the like. So
Mm.
is this something that is affordable in African countries? And is this something that is easily accessible even in Europe?
Yeah, it's difficult for me to speak because I don't work in Nigeria. But one thing
Yeah.
I said when I spoke to my colleagues, you understand, we have amazing psychiatrists in Nigeria. I know there's
Mhm.
private therapy and things like that, but I guess it would be expensive. And then if you go to a place like Yaba Neuropsychiatric Hospital
Yeah.
to access it, sometimes what we seem to be missing from Nigeria is in the system, we have primary care, we have GPs that are readily accessible.
Yeah.
The NHS means it's free from the point of entry. In
Yeah.
Nigeria, our primary care system isn't well developed. Nigeria used to be at the forefront of what we used to call community health and public health, where we had system where you could go to the where we could go to the local dispensary or you could
Yeah.
go to a community center. And I
Yeah.
really do think we need to develop that better in Nigeria.
Mhm.
You understand? It used to be, we were at the forefront of it, where we had, because I remember when I used to do my posting, you go to a village area, you have a community center where you could get prescription. And so a lot of developing countries like India, they're training lay people, they're even training like traditional healers to recognize like when there's severe mental illness like psychosis, bipolar
Yeah.
disorder, so they don't treat, if that makes,
Yeah.
and they're able
Yeah.
to refer. So I think
Yeah.
that's the future, really.
Yeah, absolutely. I think they still run the community health centers
Yes,
anyways for
yes,
maybe minor illnesses like
yes,
maybe if you have malaria. But if it is something beyond that, then it has to be paid for, even in federal medical centers. But I think
yes,
they are much subsidized when you go to government hospitals
yes,
compared to private ones.
yes. But there needs to be
Um,
more training. I think the future
yeah.
is where trade. So I'll give you in Zimbabwe, for example, they have this
Mhm.
scheme where they use grandmothers, they sit on benches and they use their wisdom to advise younger people that are presenting with low-level mental health problems.
Okay.
Yes, there's some
Um,
interesting research on that.
well, that's very interesting, really.
Yes. Mm.
Okay, thank you so much, Dr. Sule. So moving on. Can you describe what happens psychologically when someone finally shares that struggle with another person, when they eventually take time to open up, come out from that whispers and, take that courage to open up to someone? What happens psychologically when that finally happens?
I think there's this saying that a problem shared is a problem solved. If you
Yes.
share with the right person, there's a
Mhm.
sense of relief that you're
Mhm.
not keeping all of this in, that you've been able to express it to someone. And I would say there's relief. There's relief that
Mhm.
you've been able to share with that
Yeah.
person and that you're not alone. But remember, it has
Mhm.
to be with the right person.
It
you
has
know,
to be the right. That's what I
yes,
want to emphasize on, the right person. So knowing who to actually open up to is,
absolutely.
is, is key. Yeah, thank you. So moving on, what if we now decide to like seek support, probably after opening up to someone, what are some first steps for people who know they need support, but they don't know where to begin?
Yeah.
Like, you mentioned the right person. For that
Mm.
kind of person, now you don't know where to start from, but you are really willing to open up to someone. What are the first steps to take?
Yeah, so I think the first thing is to say so we think about our social network,
Okay.
So the social network, who can I speak to my social network? Remember, social network isn't just family, because sometimes family might not always be supportive. So you might look within your family, who can I speak to in my family, immediate family, extended family? For some people, it might not be their immediate family. It might be one uncle, the cool uncle that is always open to things, It could be a particular friend. And for those who have it, the internet is a resource. There's some bona fide ones where we can, like self-help websites, like livinglifetothefull.com. There's like men resources like the Men Cave. There are things like for mindfulness, like
Yeah.
Headspace. So there are resources on the internet that we can have. For men, there's one called the calmzone.net. So CAM stands for Campaign Against Living Miserably.
Oh.
And it's a website for men, I believe under the age of 55, who are at risk of suicide. And it's basically recognized that when men have depression, this can help, So, and for some people, it's like finding like a support group. It doesn't have to be focused on mental health, where they can feel supported in some way,
Yeah, thank you. Okay, let me
Yes.
just
And if in doubt,
yeah.
I always say, if in doubt, Mind, the charity Mind is a fantastic resource.
Okay.
Yes.
All right. Thank you for providing all this. I know you're giving us some signposting right there.
Yes.
But then, personally, if someone is looking at this video now and they're seeing you talk, are you open to consultancy? Is it what you do? Will you like someone to consult you for further?
So for me,
treatment?
no, I don't see people privately, But I mean, if you know someone that needs help, I can refer to people who do see people privately. I can make recommendations, but obviously it would have to be you. Then I could suggest, you understand? And sometimes, like say for therapy, there are like British Association of Psychology. There's specific bona fide, people that you can go to for treatment, whether that is therapy and the likes, really.
All right.
Yes.
Thank you so much. You've given us enough, the mindfulness, mental, charity mind. You've done some signposting, which is really, really helpful. So if you're watching this right now and you're feeling like, okay, you really need to talk to someone, Dr. Sule has provided some sites you can go to. So just reach out to them and you can take it further from there. Okay, so moving on. Well, when we're talking, I think you've already mentioned it. I wanted to ask that what can people expect from their first appointment with a mental health professional, just to keep them abreast of what they are going into. Like if they are now open up to see someone, maybe a psychiatrist, a consultant, or they are open to therapy. What are those things that they should expect first?
Yeah. So Jen, I'll give general principles, because if you're going in for therapy, will be different from going to see a psychiatrist or whatever, let's say. But what I would say you would expect someone who listens and is compassionate and is non-judgmental. If you're not getting those, then you're not in the right place. I think you need to look at broad principles. So they need to listen, try and understand, give you an understanding of what's going on, I think would be important, really.
Thank you. So if you're looking at a particular thing, Dr. Sule has provided us some qualities you have to look at. That means the person has to be able to, active listening, being compassionate, and being non-judgmental. So those are the three core qualities you look out for. And if you are looking to meet up with a mental health professional, just look look into that. If you
Yes.
don't find any of these three qualities, as Dr. Slay has said, please, you just know you're not in the right place.
Yes.
Okay, now you've talked about the misconception, really, but now I just want to add more that what are some myths about therapy, psychiatry, and medication that you would like to challenge as a consultant psychiatrist?
Okay. So one, that therapies don't work. That's a lie from the pits of hell.
Mm-hmm.
Depending, we know there's good evidence for cognitive behavioral therapy, psychodynamic psychotherapy. Medications do work. Um, so antidepressants do work and psychotics do work. They're not addictive. Yes, sometimes when you come off them, some people have difficulties coming off them, but if you reduce it slowly, you can. And the one about medication not working is an
Yes.
interesting one because the thing is there was like a research paper that basically showed that when you looked at the efficacy of psychiatric medications, they compared favorably to a lot of physical health problems, really. And I always say to my patients, when if it's very interesting about how, again, I'll bring back to the spiritualizing things.
Yep.
When you mention depression or psychosis, when I tell people I'm a psychiatrist, oh, you have to really pray. And I'm not against praying, but then, but when I say to them, if someone has diabetes mellitus, I rarely hear them saying that. They would acknowledge that treatment works. So if
Yeah.
our physical health, we take care of our physical health and we're okay to take medication, why not for mental health? It's just interesting that we make this dualism, like our physical health is separate from our mental health. And the example, like if you're anxious, you have a headache. If you have diabetes mellitus, is not well controlled, you can become depressed, if that makes sense. So they're interconnected. They're not separated as we think. We know, for example, that people with severe mental illnesses, in terms compared to their healthy counterparts, their lifespan is they live 15 to 20 years less than their healthy counterparts. So that shows you that there is a link between mental health and physical health. Poor mental health means poor physical health. Poor physical health means poor mental health, really.
Absolutely, because both our physical health and our mental health, it amounts to the overall well-being of an individual.
Absolutely.
Yeah, so talking about you mentioned the research paper. Yeah, I stumbled on a journal and they talk about, there were challenges medication in the mental health sector. But we have people that, of course, they get admitted into the sector and the cycle continues, they get discharged, they come back again. Does that mean the medication is not working? So I was reading the journal and somebody was challenging that why, when you get when you have physical health challenge, for example, they do the surgery and you get on medication, maybe some medication to help you heal fast, and you are not going back to that surgery again. Aside maybe cancerous cells or all of those ones. But when it comes to mental health and they administer medication to this person, the person seems to be getting fine, and all of a sudden they get discharged and they're back into the system. So what is really going on? Is it really, are we really
I'm
saying
so happy you asked that question. So it's a question I get asked a lot. My view, what I say to them is the way to consider at least conditions like depression, whether that's depression, schizophrenia, anxiety, it's a bit like what you have with high blood pressure and diabetes mellitus. So, with diabetes mellitus, if you've got diabetes mellitus, if you take your medication, you stick to it because it can be a chronic condition, you might get your blood glucose control. But if you don't eat right, your blood glucose might go up. You might have to go to the doctor to have your medication adjusted. The same thing for high blood pressure, where we have high blood pressure, you don't take your medication, you're at risk of strokes, heart problems. I think for some mental problems, they're a bit like that, if that makes sense. So we take a chronic disease model.
Compliance with their medication.
Absolutely, yes. And also lifestyle changes that we don't make. So if that makes sense. So yes, we use the term remission. Someone with a psychotic episode, we've seen it. They have one psychotic episode, they take their medication, they're compliant. They just have one psychotic episode and that's it, they're done. Others would have the psychotic episode, might not take their medication, relapse. Others would have a psychotic episode, take their medication, but there might be stressors in the family, they might be involved in toxic relationships, and so it's very similar to, say, what you have with diabetes mellitus and things like that. It's a myth that if you have diabetes mellitus, no one says if you have diabetes mellitus. You find people visiting their doctors or their GPs to check up on, do regular checkups. The same thing with high blood pressure.
Okay, now talking about all of these things, another myth, is it a myth that once someone in the family has a mental health challenge, it continues in that family? Is that a myth, or it can also be associated with external factors?
So what I would say is, they talk about stress vulnerability pathway. So yes, there can be genetic factors, which is genes. So you are at risk, but that doesn't mean you are necessarily going to get it. Sometimes it's that whole connection between stress and genetic factors. So if you're at high risk of genetic factors, let's say you have two parents with mental health problems, low stress would increase the risk. But there's some people that have no family history that stress would increase it, if that makes sense. So it's often the interplay between stress and vulnerability. So it's not a given that you have two parents and you would have it, if that makes sense. So we're talking about the vulnerability. And I always say with those things, sometimes sometimes it's not necessarily due to genes. Sometimes if you have two parents with mental health problems, sometimes it's vicarious learning. It's what you see, it's the impact on child rearing also, you understand? But what I say to people is, when you know your genetics or your risk, you can choose protective environment. So for example, if I know I'm in a family where mom has an addiction to substances, dad has an addiction to substances, since I know I'm at high risk, I might choose a protective environment. So I might say, I'm going to be very religious, go to church, avoid alcohol, avoid cannabis, if that makes sense. So there are things we can do to reduce that chance. So they're not always an absolute. And sometimes for some people, they might have no family history, but the environment is so toxic, the stresses are so toxic that they end up with these difficulties.
Okay, wow. That makes sense. So that means people that have the gene in their family, they can be more triggered, as in they're more susceptible and vulnerable.
They could be, yes. But it's sometimes we attribute, because the family history, that if someone has a family history of mental health problems, if the child has it, it's due to genetics. It's not always due to genetics. It could be the environment. So it's never really straightforward, if that makes sense.
Yeah. Thank you for that clarification. That was so profound. Thank you so much. So after years of working with patients, what has surprised you most about human resilience? Like you mentioned, like if you know you're in that family, you can choose a protective environment. So what has surprised you really about human resilience when it comes to things like that?
Sometimes you'll be surprised that people coming from the most desperate circumstances and that have suffered the most trauma, there's no impact on them. It's very interesting, you understand? And it's, there's a whole stuff about resilience literature. So there's things like stress inoculation, which when you're exposed to amount of stress, where people build up resilience. Sometimes people have certain personalities where they have what you call a locus of control, where they believe that they're in control of their destiny. There are all these factors that come together. For further reading, there's a guy called Rotter that's done a lot of research on this particular literature. So that's very interesting, really.
Thank you so much. In fact, your experience is really speaking, the perspective and the way you're able to touch different aspects of everything for us to comprehend this topic. That was amazing. So if there's one thing you wish every person understood about mental health, what would it be?
So with mental health, I would say if what amazes me is, don't downplay mental health. people get the physical health, high blood pressure, and this is why the work you're doing, Amashola, is so important. For physical health, high blood pressure, diabetes, people are on it. But with mental health, people sneeze it. Give it the same amount of attention as you would to your physical health, and hopefully the funding should go with that as well. That's what I would say.
Wow, thank you so much, Dr. Sule. And there you have it. Seek help. Seeking help is not a sign of weakness. It is an act of courage and self-compassion. Dr. Sule has done justice to this topic, and this is a rare opportunity. Watch this over and over again. Share to your friends and family. They need to really learn from this conversation. So on behalf of everyone watching, I would like to extend our sincere gratitude to Dr. Akeem Sule for sharing his invaluable experience, wisdom, and insight with us today. So it has been a rare privilege to learn from your experience and expertise. Thank you all to all our audience, wherever you're watching from, wherever you're joining from. And please, let's continue to foster understanding, encourage open conversations, and remind one another that help is always worth taking. Thank you so much, Dr. Sule. But before you go, aside work, how do you unwind? What are the things you do that makes you like, you want to recharge from the work ethics, from being burned out?
So for me, I would say, first of all, my relationship with God, church, family, and I like party. I like music a lot. So you will know that I'm interested in, like, okay, although it's going back to work, but like popular culture and mental health, looking for themes of mental health in music, and in TV shows as well. I analyze TV shows for mental health themes. I find that quite interesting, So yeah.
Well,
Yes.
that's pretty good to know that about you. Thank you so much
Yeah.
for gracing this occasion, for gracing our invite. We really appreciate you. Thank you once again for joining.